Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the internal carotid artery. The internal carotid artery arises from the bifurcation of the common carotid artery. This is the common carotid artery and this is the internal carotid artery. The common carotid artery bifurcates at the level of the upper border of the thyroid cartilage and the intervertebral disc between cervical vertebra 3 and cervical vertebra 4. The internal carotid artery has four parts: cervical part that is present in the neck, then the petrous part that is a part of the temporal bone, cavernous part, the part of the internal carotid artery when it passes through the cavernous venous sinus. The cerebral part, the part is at the base of the brain. So we are looking here. Here is the petrous part of the internal carotid artery. This is the cervical part of the internal carotid artery. This is the cerebral part of the internal carotid artery. So we got the four parts. The cavernous part has not been shown here, but we'll get it very soon. So the cervical part ascends vertically through the neck to the cranial base, to the base of the skull. It has no branch. The internal carotid artery, it has no branch in the cervical part. That means internal carotid artery has no branch in the cervical part. It enters the carotid canal in the petrous part of the temporal bone. So it enters the carotid canal. That canal is present in the petrous part of the temporal bone. Courses anteriorly through the cavernous sinus. So this is cavernous sinus. We have a lot of venous spaces lined by the endothelial cell. The artery passes through these spaces, but the arterial blood is separated from the venous blood by endothelial layer. So in a healthy person, arterial blood is separated from the venous blood. And the course through the cavernous sinus is not straight, rather it is curved. Courses through the cavernous sinus terminates into the anterior and middle cerebral arteries in the base of the brain. So we got cervical part. Cervical part enters the petrous part of temporal bone through the carotid canal. Carotid canal also contains the sympathetic plexus of nerve and also the venous plexuses. And it passes to the petrous part of temporal bone, then it enters the cavernous sinus, then it comes out of the cavernous sinus. Cavernous sinus is present at the side of the body of the sphenoid bone. This is the sphenoid bone. This is the pituitary fossa. Okay, so the internal carotid artery passing through the cavernous sinus comes out of the cavernous sinus at the base of the brain and divides into anterior and middle cerebral artery. It has other branches, we'll go there. Terminal branches are the anterior and middle cerebral artery. These arteries are important component of the circle of Willis, the arterial circle at the base of the brain. So we'll go to the branches of the internal carotid artery and circle of Willis. This is the cervical part. This is present in the carotid sheath along with the vagus nerve and the internal jugular vein. The cervical part of the internal carotid artery enters the petrous part of temporal bone through the carotid canal Then in the petrous part of temporal bone, it gives branches, caroticotympanic arteries, artery to the pterygoid canal, but cervical part has no branch. Then it goes to the cavernous sinus. This part is cavernous sinus. And in the cavernous sinus, it has multiple branches, like that of the branch to the trigeminal ganglion, inferior hypophyseal artery, marginal tentorial branch, basal tentorial branch, and meningeal branch, cavernous sinus branch, and we'll get these all branches in the cavernous sinus. Then it comes out of the cavernous sinus. Here in the cerebral part, it has the ophthalmic artery that goes to the eye. Ophthalmic artery, from the ophthalmic artery we'll get the central artery of the retina. Okay, so ophthalmic artery will also provide blood supply to the orbit, and we are getting also superior hypophyseal artery here. This is the posterior communicating artery, the anterior choroidal artery, and this part will be terminated into anterior cerebral artery here and the middle cerebral artery. We have the posterior communicating artery, and this artery will contribute in the formation of the anterior part of the circle of Willis, posterior part by the vertebral artery, basilar artery, posterior cerebral artery, anterior part by the anterior cerebral artery, middle cerebral artery. These are the two big branches from the internal carotid artery. We have other branches we have just discussed, ophthalmic artery here, the anterior choroidal artery, posterior communicating artery, branches of the internal carotid artery. So we'll go to the clinical correlations. Okay, we have to know that any branch of the internal carotid artery may be blocked. That may lead to cerebrovascular accident. We also call it CVA or stroke. That may be possible. Other clinical correlation other than stroke, aneurysm of the internal carotid artery. This is cavernous venous sinus, and artery has abnormal dilatation here. We call it aneurysm. That may be ruptured. Okay, so the venous blood, arterial blood may be communicated. Or due to any type of trauma, there may be cavernous artery, there may be internal carotid artery, cavernous sinus fistula. Communication between the internal carotid artery and the cavernous sinus is possible due to trauma. That is sinus, there is a carotid artery, cavernous sinus fistula, arterial and venous blood will be communicated. High pressure arterial blood then will be manifested by the pulsating movement of the eyeball. Okay, so we have clinical correlation, stroke, cerebrovascular accident, any branch of the internal carotid artery may be blocked by embolus. There may be aneurysm of the internal carotid artery. There may be carotid artery, cavernous sinus fistula. Carotid artery means the internal carotid artery. And that's all about the anatomy of the internal carotid artery. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. And have a nice day. Bye now.